Transmissible Gastro Enteritis, or TGE, is an acute, rapidly spreading viral disease in swine of all ages, characterized by diarrhea and vomiting. High mortality in piglets under 2 weeks of age is common, with the mortality decreasing with age. TGE naturally occurs only in swine. TGE throughout the year may be higher in colder months and lower in hotter months. TGE occurs in major swine-raising countries, but is infrequent around Europe. The causes of TGE. The virus is shed in large numbers in feces. Pig feces, therefore, is a major source of transmission, either directly through a purchased carrier pig or indirectly through transport. Poor cleaning of pen floors, poor pen hygiene associated with bad drainage, poor hygiene products, and poor changes in between pens can also cause this disease to spread. Feeder pigs can also get it from feeder pipes and feed bins. This is a higher risk source for the spread of this disease. Dogs, birds, and other animals may also have the virus in their feces. Dogs for 2 to 3 weeks. Contaminated feed and continual use of buildings without all in, all out may perpetuate this disease. In acute outbreaks, the incubation period for TGE is very short, usually 18 hours to 3 days. In baby pigs, the disease spreads rapidly to affect all susceptible pigs. Signs include profuse diarrhea, frequent vomiting, rapid dehydration, shivering, and marked thirst. The pigs weaken rapidly and usually die within 1 to 2 days. Pigs suckling immune dams may remain well as long as they receive adequate antibodies in the dam's colostrum and milk. Pigs infected after 4 weeks often survive. In feeder and fattening pigs, signs are usually mild except for the diarrhea, which is profuse and watery within a few days. Vomiting occurs occasionally in younger pigs. Morbidity is high and mortality is low or absent. Moderate severity is observed in knaves, sows, and gilts, especially those that have failed recently and are heavily exposed to the virus. Dams show anorexia, vomiting, diarrhea, depression, and may cease to lactate. Recovery usually occurs within 5 to 10 days. In the severe acute outbreak in breeding herd or fail to finish herd, the clinical picture provides a strong presumption diagnosis. A main feature which differentiates it from diarrheas is that all age groups are affected with TGE. Mild outbreaks of this disease may be difficult to distinguish from PED on clinical grounds. To confirm the diagnosis, samples must be sent out to the laboratory without delay. The best samples are freshly dead or dying piglets. In grower finishers, send the youngest pig you have. Also send paired blood samples from early in the outbreak and again 10 days later. The best test, which will give you the answer in a matter of hours, is to freeze the ileum, or the last part of the small intestine, section it for histology, and carry out fluorescent antibody tests, FATs, on the sections. There is no specific treatment for TGE. Antibiotic treatment by mouth can be distributed to individual piglets to reduce secondary infections. Be sure to provide easy access to water containing electrolytes and the antibiotics, such as neomycin. Make sure this is available to litters twice daily. Also, try to improve the nursing and environment of the litter by providing extra heat and deep bedding to reduce the waste of infection from the diarrhea. Remember, this disease flourishes in colder climates, so be sure to heat up the pigs. The most important part of this disease is control and prevention, and the best way to do this is management. Its most important precaution is carefully loading the pigs, keeping out visitors and startlings, and birds and animals such as seagulls. As soon as the disease is suspected, isolate those farrowing houses not infected by separating personnel boots and coveralls. This is particularly important in piglets under 14 days of age. The longer the disease can be kept away from more pigs, the lower the mortality rate will be. If possible, move sows that are within 3 weeks of farrowing from the farm before they become infected so that they can farrow down in an isolated building or outside in the arks to escape the disease. Disinfect all of the pens in between batches. This should be carried out using iodine-based disinfectant or one highly active against viruses. The cleaning process is an important one to ensure that the virus does not linger on the farm and become an epidemic. Vaccinations do not work well with TGE. There is only one main serotype of TGE, and theoretically it should be possible to produce an effective vaccine. But because of the type of immunity involved, most commercial vaccines available are not very effective. Should you be worried about this disease? Yes, here in the U.S. you should. A few countries are thought to be free of it, which are Australia, New Zealand, Ireland, and Denmark. Australia and New Zealand are so remote from the source of infection and have such strict import controls that they are most likely to be uncontaminated. If your herd is susceptible to TGE and becomes infected to 100% of the piglets under 2 weeks old, they will all die. Many older suckling pigs and some weaned pigs may also die. A proportion of recently bred sows will also return to service. As a rule of thumb, you can predict that the number of young pigs that will die will be 1.5 times the number of breeding females in the herd. The precise number depends on the actions that you take and the co-current diseases present in your herd. Think of it this way. If a herd is feral to finish, you will suffer substantial loss of revenue and negative cash flows for 4 to 5 weeks, about 4 to 5 months after the outbreak, and another 4 to 5 months later. TGE is an economically damaging and highly infectious disease of pigs that is enzoonotic in most pig-rearing countries of the world. Thus, the majority of readers, it is not an exotic disease, but an enzoonotic and serious risk to your herd.